Let's stay with our leading story now. The Gauteng Premier's Advisory Committee on COVID-19 has recommended that the province be moved to a hybrid of level 3 and level 4 lockdown regulation. They say that level 5 would be too stringent. They've been updating on the status of the coronavirus in Gauteng. Let's get some reaction now from Professor Shabir Madhi, a vaccinologist at Wits University. Professor, good afternoon to you. Now, perhaps before we talk about the stringent measures that will be introduced or proposed to be introduced by the Gauteng government, help us unpack the severity of the third wave in Gauteng. I mean, we understand that this is even more severe than the first and the second waves.
So good afternoon to you. So unfortunately, that is correct. Currently, the peak in terms of daily rates of infection per 100,000 of the population as of yesterday is already more than twice what it was at the time of the peak of the first or the second wave. In addition to which, this particular wave, the upward trajectory of the wave is much more steep than what we experienced either in the first or the second wave. So all indications are that the number of documented COVID-19 cases in this particular wave will probably be at least 2 times higher than what occurred either in the course of the first wave or the second wave. What remains unclear is whether this is going to also translate into an equivalent number of higher cases of hospitalization and death. There is some indications that that might not be the reason, but at the same time, in absolute numbers, unfortunately, our healthcare facilities are likely to be overwhelmed. Most of them are already running at close on to 100% occupancy. But in the course of the next 2 to 3 weeks, irrespective of going to higher levels of restriction in the province, our healthcare facilities, unfortunately, are going to be under severe strain.
Now, before we get into, just how the facilities will be able to cope, perhaps let me just go back to our introduction where we were speaking about some of the restrictions that, the province is trying to see if they can implement. I mean, interestingly, the chairperson of the Gauteng Coronavirus Command Council, Dr. Mary Kawunga, says that moving the province to level 5 is firstly too late, and also it would be too stringent. So where then is this balance? I mean, they're proposing something like moving to a hybrid of level 3 and 4, finding some common ground in terms of, just dealing with the severity of this third wave.
Yeah, unfortunately, Gauteng is almost peaking in relation to this current wave. Probably by the end of next week, we should start seeing a decrease in the number of reported cases, daily reported cases. But at the same time, we're going to start seeing an increase in the number of hospitalizations and death. So it's way too late to even think of a level 5 restriction at this point in time. It's going to have a nominal effect. The most important activity that we need to restrict is gatherings indoors, including in places of worship, unfortunately. It doesn't make a difference whether you've got 10 or 50 people in a poorly ventilated indoor space. Those would equally be able to contribute to super spreader events, which is largely what has probably driven what we're currently experiencing. So going to higher levels of restriction is going to have a nominal effect as to what is going to transpire over the course of the next 2 to 3 weeks, because hospitalization and death that occurs from COVID-19 usually lags behind by about 2 to 3 weeks compared to the infections that are taking place in the community. And as I indicated, based on the pattern of the first and the second wave, it's very likely that we're about to peak when it comes to infections that are occurring in the community, probably by the end of next week.
Just by talking about the severity of this third wave and listening to what you are saying now about it being too late to move into that level 5, the province has been criticized a lot for, just being too slow in dealing with this and perhaps maybe even foreseeing that we will be in this crisis that many have labeled it. Interestingly, Premier Makura said earlier that the government shouldn't be asked or criticized about the fact that they were not ready, but a question should rather be asked is what is it they didn't do? So perhaps it's a little bit unfair for me to pose this to you, but what is it that this government could have done to prevent us being in a crisis situation?
Well, firstly, we should have had a much larger percentage of the population, especially the high-risk individuals, already vaccinated. And there was a series of miscalculations on the part of government, which has resulted in a minuscule proportion of the high-risk individuals already being vaccinated. So the resurgence is not a problem. It's the high-risk individuals that are unvaccinated that's a problem, because those are the individuals that are ending up in hospital and dying. That we were going to experience a resurgence in May or June is something which was already predicted at the end of January, myself included. So I think to deny that there was any suggestion that we wouldn't experience a resurgence, I think that would be ingenious, because this was already predictable already in the end of January when the second wave was subsiding. Yes, government is to be blamed. We wouldn't be having this discussion if our healthcare facilities were adequately staffed, if all of the billions of rands that we invested in the COVID-19 facilities were fully operationalized. And I'm not just talking about the wonderful beds and equipment that those facilities have, but we've already had staff in place to ensure that when people end up in hospital, that they could be cared for in those COVID-19 facilities. Right now in Gauteng, there's more than 1,000 COVID-19 beds that were specifically built for that purpose, which are being not utilized, whilst our hospitals, including hospitals such as Helen Joseph, is being completely overwhelmed for the past 3 weeks, not just as of yesterday. So poor planning on the part of government in terms of not ensuring that those healthcare facilities that were actually built and designed for the purpose of a resurgence have not been operationalized because of a lack of staffing, that is a government problem. That is not a problem of the citizens of Gauteng. So poor planning in terms of when people were vaccinated, how quickly we got people vaccinated, and not ensuring that the facilities are adequately actually resourced with humans so that they can be used to save lives, that unfortunately is a consequence of poor planning.
All right, talking about vaccines, Prof, we know that there is this march tomorrow that is going to try and urge a government to look at some of the vaccines that have been approved by the WHO. What do we know about these emergency vaccines? I know that 2 of them are from China and 1 is from Russia.
Yeah, so I find it absolutely astounding that government wants to now introduce a Sinovac vaccine, which comes from China, and the Sputnik 5 vaccine that comes from Russia, whilst it wasn't prepared to use the AstraZeneca vaccine, when the AstraZeneca vaccine has actually got more compelling evidence that it would actually protect against severe disease due to the beta variant in South Africa than either the Sinovac or the Sputnik 5 vaccine. What we expect of all COVID-19 vaccines, including the Sinovac and the Sputnik 5 vaccine, is that they very likely would protect against severe disease due to COVID-19, due to the beta variant causing COVID-19. So all of the vaccines are likely to have high levels of protection, but these vaccines will differ tremendously when it comes to protecting against mild disease, including the Johnson & Johnson vaccine. So what we know about the Sinovac vaccine, as an example, is a country such as Chile that predominantly uses the Sinovac vaccine is currently experiencing a massive resurgence of COVID-19 as well, despite a high percentage, close on to 2/3 of the adult population already having been vaccinated with a Sinovac vaccine. And the reason is that that vaccine is not working well against the Gamma variant that's circulating in Latin America. And the vaccine is not going to protect too well against mild diseases. It probably won't have any protection against mild disease due to the beta variant. So again, I find it absolutely stunning that on the one hand, government decides to sell off the AstraZeneca vaccine, 1.5 million doses that could have been in the arms of people and protect them against severe disease during the course of this resurgence. And then now he's talking about trying to procure the Sputnik 5 and the Sinovac vaccine, which has got even less evidence compared with the AstraZeneca vaccine as to whether it would actually protect against the beta variant COVID-19 disease.
All right, Professor, thank you so much for your time this afternoon and for that very concise analysis. Professor Shabir Madhi, a vaccinologist at Wits University.